Hi everyone, I'm just waiting a couple of minutes just to let everyone else join. We'll start about 5 past, that's alright. Can you just comment in the chat if you can hear me? That would be great. Sorry, I've just seen in the chat. Can you hear me any better now? Yeah, fab, okay. Right, we'll get going. When I'm viewing the actual slides, I can't see the chat, so I'll flick back periodically just to make sure I'm not missing anything. So my name's Dominic Quigley. I'm currently an F2 doctor at Epsom and St Helier Trust in London, and we'll be moving to St Thomas's in London in August, where I'll be doing a junior clinical fellow role in ICU. So this presentation is about what to expect in terms of ePortfolio as an F1, and to be honest, also as an F2, and what the requirements for ARCP are. This is the contents of what we'll go over. The overview of the portfolio, ARCP, mandatory forms for both the placement and the year, clinical summary narratives that you'll need to fill in, additional achievements, personal learning logs, and finally look at the HLOs and where to map things throughout your portfolio. So, as I'm sure you're all aware, you'll probably have had various different portfolios that you had to fill in throughout university to try and get you ready for this process. In all honesty, I actually feel that the NHS portfolio, particularly for F1 and F2, is far, far simpler than it was at my university. And I also think that if you fill it in as you're going along and you make sure you keep up to date with it, there's relatively little that you need to do, and it just kind of ticks over. But if you let it get ahead of you and you fall behind, then it becomes quite difficult. So, overview of the ARCP. So the purpose of the portfolio is to demonstrate that at the end of F1, you've reached a level of competency that is required that allows you to work without as much supervision going into F2. So the way that this is shown and evidenced is through your portfolio. So the ARCP is the annual review of competency progression, which is when all of the F1 portfolios are audited by their trusts at the end of F1. And the same thing actually happens at the end of F2. Actually, the same thing happens until you hit consultancy. You'll have an ARCP every year. And actually, even at consultancy, you still have regular reviews. So it's something to get in the habit of now. Key dates, but these are likely to change. So ePortfolio closes generally in May, with ARCP following this. So in 2022, it closed on the 27th of May. We are currently towards the end of July. I think in F2 this year, it closed mid-June for us. So yeah, you don't have quite as long as you expect once you get going. The important thing really to remember is that it always closes midway through the third block. So you do your F1 first block, F1 second block, and then midway through your third block ARCP, the ePortfolio closes and then ARCP occurs shortly after that. So you need to make sure that you actually have everything in there realistically by the time you're coming to the end of your second block. The other thing to be aware of is that the closing date, dependent on what trust you're at, could potentially be a week earlier. So sometimes they make the closing date a week earlier to force you into having everything uploaded, and it makes the review process a bit easier. So just be really aware when you're starting of your dates for ARCP. Okay, so mandatory forms for each placement. What we'll do also as we go through is I'll talk through most of the slides, so don't worry about making notes particularly. I'm sure you'll get access to these slides afterwards. I've also got some top tips throughout, and I'll try and draw your attention to various points from screenshots and things like that. So mandatory forms. I use Horus as my portfolio because I'm in England, but I know that Scotland use Taurus. It's all essentially the same platform, and they all essentially have the same forms and requirements. So mandatory forms for each placement can be found at the top when you access your portfolio and you click on forms. The mandatory forms for each placement appear at the very top, first at the beginning, and then these ones here at the end of each placement. So the main things to take away are your educational supervisor, which you should have all been assigned by now, will have to do both the clinical supervisor meeting and the educational supervisor meeting at the end of first block. So they'll do your initial meeting, they'll do your induction meeting, and then at the end, they'll do your supervision review and both educational and clinical. At the beginning of the second and third placements, the initial meeting you will need to repeat with your educational supervisors and the induction meeting with your clinical supervisors. So actually, the best thing to do generally is at the end of each block to book a meeting with your educational supervisor to get the initial meeting with your educational supervisor done at the start of every single block. Okay. At the beginning of all three placements, a PDP needs to be completed, and this is this one down the bottom. So it's a personal development plan where you'll outline things that you want to get from each placement. So you'll need to make sure you do that at the beginning of every placement. And the educational supervisor's end of placement report replaces the the educational supervisor's end of placement report is done at the end of the first and second rotation, but is replaced by the end of year report at the end of the third. So it's found here. Educational supervisor's end of placement report, that needs to be done at the end of first and second. But then there's another form, which is the educational supervisor's end of year report, which needs to be done at the end of the year instead of that form there. Okay. The other thing that's mandatory is the placement supervision group. Local rules apply to this, but generally you only have to do one each year. So some trusts will try and get you to do one each block. If they absolutely need that, then you need to do it. But sometimes they try and get you to do one so that if it's poor, you can then reflect on it and show progression by getting a better one in the second block. So just be aware of why they're trying to get you to do more. Okay, so mandatory forms for the year. In fact, let's pop back to that. Any questions at that point, check them in the chat now, just so I flip back. Okay, no questions so far, but I will flip back again, okay? So that's mandatory forms for each placement. Mandatory forms for the year can be found slightly further down. So here you need to do at least one quality improvement project. So this is either a quit or an audit. Sometimes some trusts will try and get you to do both, but realistically you only need to do one. As a top tip, it's worth doing it in something you're interested in, or at least that might demonstrate some career progression, so that then when it comes to applications for core training, IMT or ACCS, you can then use whatever QIP or audit you did in interviews and as points on application. You'll need to be doing reflections regularly. So most trusts will have their own mandatory number of reflections that you need to do. The trust that I'm in currently, we needed to do two 2 per rotation. So please make sure you're aware and you check with your postgraduate education centre how many reflections they would like you to be filling in for each placement, not just for the year. It's very easy to do 2 reflections each placement, but trying to then do 6 at the end of the year and think of 6 random things that you may or may not get some adequate reflection on is really not beneficial. The other mandatory form for each year is the Educational Supervisor's End of Year Report. So this is what I was speaking about before, which takes the place of the Educational Supervisor's End of Placement Report in the 3rd rotation. So you need to make sure that they fill in the right form at this point. So it's worth being aware of that at the beginning so that you can then in that last review, just in case they're unaware, make sure that they fill in the correct form. As a general top tip, the other thing to do is when you have your initial meeting with your educational supervisor in block 3, set a date with them then to come back and do the end of year report, because most likely that will only be in 6 to 8 weeks time. If it's a really good educational supervisor and they meet with you day 1 on 3rd block, it will be 8 weeks, sometimes less depending on when your ARCP is due, but generally it's sort of 4 to 6 weeks and it's something that can be booked in the diary. The other mandatory form to be aware of is Form R, and we'll discuss that a little bit later. Next, sorry. So let me just flick back. Okay, we've got one question. Do we have to finish the end of year report before ARCP? Yes, so that will need to be submitted before the ARCP deadline. Okay, so Form R is a form that is only made available at the end of the year and during your rotation 3. So you actually won't be able to access it properly during the rest of the year. So don't worry about going looking for it. The postgraduate centre release it. So it outlines any leave, sickness, maternity, paternity leave you've taken, but it's also relevant at the moment. You need to mention how many days out of training you've had in terms of strike days as well. So they are all accounted for. It also outlines any significant events, complaints, or other investigations that you've been involved in. It's not a blaming form or anything like that. It's just so that you can record what you've been involved in, say if it's closed or not, and if it's not, then at your ARCP the next year, you would then need to say if it was closed, and if so, what the conclusions of that were, so that people can make sure that you're progressing adequately. It's also an opportunity to state any compliments that you might have had throughout the year. So, if you were working in A&E and get some positive patient feedback that was sent to the department, then you can record that in there. That's not often done, but it's worth noting, and it obviously reflects well on you during ARCP. Top tip is just to be honest in these forms. Mistakes happen, people get investigated for things all the time, and the NHS is now adopting this no blame culture. But the most important thing is that you're just honest about them if you're involved in them. And it will all, because obviously if you're found to be dishonest, then it enters into probity issues and GMC get involved. Whatever you add to Form R, make sure you've discussed with your educational supervisor before you put it in there. They will be a little bit surprised if they suddenly see a significant incident in there which you haven't discussed with them, and they may be able to give you some guidance on what else you might want to include in your portfolio in terms of reflections and things like that. But also, obviously, any of those sorts of things you would want to discuss with your educational supervisor, because they would be able to give you some really good advice. Got another message. What is the supervision group that was mentioned at an earlier slide? Placement supervision group. So it's a mandatory form for each placement. I think I've got a slide on it later. No, maybe I took it out. Okay. So the placement supervision group is a form that you send out to all the staff, basically, that you're working on a placement in. So say you're on the respiratory, or your second block is respiratory, and you want to do your placement supervision group then, you will send this form out to 4 consultants, 4 nursing staff, 4 junior doctors, 4 senior doctors, and the receptionists and pharmacists, and they will then anonymously give you feedback, which can be recorded in your placement supervision group. So it's basically just a way of getting anonymous feedback at a specific point in the year. It could be on a placement that you've really enjoyed and really made friends with all the team, to ensure that you get very good feedback if you so wanted. But yeah, it just basically makes sure that you can work well in a team, and that although your portfolio might be glowing because you're uploading everything, that actually you're performing well within the department as well. So I hope that answered that question, Emily. So, Omar, this is by no means anything that is official. You can screenshot it if you want. It may be subject to change. Local rules might apply, but this is my suggested timetable. So when you start in block 1, you want to be making sure that you're doing your combined meeting at the beginning, that you're doing your personal development plan, that you're doing your clinical supervisor report at the end, your educational supervisor at the end. You've uploaded your PSA. You've done a tab, which can be sort of a tab and a placement supervision group are very similar. So if you need to do one tab per year. It's exactly the same as the placement supervision group. You outline people that you want to send it to. They give you anonymous feedback. I would do the tab in one and the PSG in another. And then your QR you could do at any point. I would make sure I was doing my reflections throughout the year. And then end of educational supervisor's end of year report comes last, and Form R comes in the last block as well. So feel free to screenshot that if you would like. It is not official. It doesn't. It may change. Difference between PSG and tab. There is no real difference. One of them is slightly more in depth than the other, but for all intents and purposes, they're the same form. The team assessment of behaviour, the tab, is more personnel. So that's where it's doctors, nurses, auxiliary staff, all the rest of it. Whereas the PSG, you just ask for consultants or senior registrars to reflect on you, as opposed to the nursing staff and other F1s, F2s. Curriculum narratives. So when you open your portfolio, and you can click this down arrow into your portfolio, you click curriculum, it will bring up all of the curriculum and evidence that you've mapped to it, but we'll go into mapped evidence later. But next to each HLO, the learning outcomes, higher learning outcomes, you will see this button to add the summary narrative. That's the clinical summary narrative. There are 3 in total. One, and basically what you'll need to do is every rotation, every placement you're on, so 3 placements at the F1, at the end of that placement, you will need to add to the clinical summary narrative 100 words, because there are only 300 words in total per HLO. So each placement accounts for 100 words in each HLO about how that placement has added to your progression as a doctor. Okay, so the first HLO is an accountable, capable, and compassionate doctor. The second one is a valuable member of the healthcare workforce, and the third one is a professional responsible for their own practice and portfolio development. So within each of those, you need to add to the clinical summary narrative 100 words per placement, and you'll need to relate what you're writing to that HLO and any evidence that you've mapped within that. So what I would advise is, if you're struggling on what to write or struggling where to map, you can map evidence specifically with the intention of then in your clinical summary narrative outlining why you have mapped that to where you have mapped it, and how that demonstrates that you are capable and compassionate or a valuable member of the healthcare workforce. So for example, if you do your tab or your PSG and you map that to your HLO2, you could then say within your clinical summary narrative, I have received very positive feedback about the way in which I work as a team in the A&E department, shown in my tab feedback that I conducted during this placement, amongst the other 100 words that you would write for that. Okay, so does that make sense? Do we have any questions there? Lots of questions. Good. Okay. Do we have to meet with CS in block 1? Your CS and your ES in block 1 should be the same. If they're not, you'd have to meet with your CS separately, but they should be the same in block 1. So your clinical supervisor will be your educational supervisor throughout the whole year. PSA, that's the prescribing safety assessment. So you should have done that in university, and you just then need to upload your certificate of completion, of successful completion. But occasionally people haven't done it or need to resit it for whatever reason. And then once you have completed that successfully, you just upload that into the PSA section. May I please ask if each clinical summary has to be at least around or under 100 words? So you get 300 words in total for each clinical summary narrative. As a guide, I would try to go for 100. If you go for 150 on one placement and then 50 on the next and then 100 in the last, that's absolutely fine. If you go for 98 on one, 80 on another, and 100 on the other one, and you don't quite hit 300, that's fine. But it's just you have 300 words max. And actually what you find is when you get writing, 100 words is next to nothing. So, yeah. Okay. So, SLEs. SLEs are forms that you'll find that you need to do throughout the year. So what these are mandatory forms. You don't need to necessarily do, one each block or loads and loads of them. But these will be the ways that you demonstrate that you are gaining skills, reflecting on the work that you're doing, progressing in terms of how you're doing in the department, as well as a clinician and your own skills. Okay. There's no minimum. However, I would aim to upload at least one of each SLE per placement. Okay. And whilst that might seem like a lot, so there's 1, 2, 3, 4, 5, 6, it actually really isn't very much at all, because what you'll find is that if you speak to one of the core trainees about a patient on the ward who you've seen, and you were a bit confused about their management, or you were confused about the way in which they had attended hospital, or for anything like that, that's a case-based discussion. So you could discuss that with the reg on the ward, and then at the end of it be like, oh, do you mind if I send you a CVD for that? And they will obviously say yes. Equally, you could be asked to go and take some bloods from a patient or do a difficult cannulation, and you do that. You've done an observation of procedural skill, and then you just turn to the reg at the end and you say, do you mind if I send you a doc for that? They'll have no problem with that at all. So actually, these are all things that you do regularly, but you just need to be on the ball about getting them actually signed off. Some other top tips to be aware of is that each SLE has, so you fill in what you've done, you fill in sort of reflection on the event or what have you, and then it also has a feedback on the behaviours observed and agreed action section, which is where the trainer can fill in how they think you could improve. Now, that is by far and away the longest part of the form, and often why people are like, oh, I can't really be bothered, can you sort it with someone else? But if you sit down and you have a conversation with someone and they say, yeah, that was really good, but actually, go away, have a look at this, do some reading up about osteoarthritis, because you need to work on your management for that a little bit. All of those things are feedback and agreed actions in terms of what you need to do. So you can fill that section of the form in, you can send it off to your trainer, and they can literally just review the form and then click, yeah, that's all fine. Or they can add something if they would like to. All of it can also be filled in retrospectively. So as I say, you can discuss it with someone on the ward round. You could even then 2 days later go up to them and be like, look, that conversation that we had the other day about the patient with a HAP, do you mind if I just send you a quick learning encounter and reflection note for that? I'll fill in the details. Are you happy with the agreed actions that I need to learn more about pneumonia? Yeah, that's absolutely fine. Okay, so does anyone have any questions about that at all? Again, some more questions, which is great. What is the level of the assessor for my SLE, e.g., can SHO fill in my form? So F1s and F2s can't fill in the form, but anyone above that can, which includes clinical fellows, and even on some forms, pharmacists. So if you want to do a CBD with the pharmacist on meds reconciliation or what have you, then they can sometimes fill in the forms as well. Sorry, it was 100 words in each HLO, 1, 2, and 3, or 100 words overall per placement. So 100 words for each placement in each HLO. So each HLO will then have 300 words in total. So the 3 HLOs between them will have 900 words. I hope that makes sense. Okay. And for anyone asking, SLEs is supervised learning events. So additional achievements. This is basically where you can show off. So at the bottom so we've discussed what's mandatory. SLEs are also mandatory, but there's no minimum number unless your trust states there is a minimum number. However, I would aim for one of each per placement. The additional achievements, however, are not mandatory, but they will show that you're really engaging with the portfolio process and be able to give you sort of brownie points and extra stuff on your CV to make sure that you stand out from the crowd, particularly when it gets to core training applications and that sort of thing. So additional achievements is basically anything that doesn't fit in an SLE. So if it was something that you were doing in hospital, anything that you were doing in hospital, basically, you could do an SLE on it. If it's something like this talk, for example, this will go in my additional achievements. If it's anything you're doing outside of work, you can pop it in your additional achievements. If it's a course you've attended, it's additional achievements. And it's anything that you feel would improve your ePortfolio. And that's not just academically or in a hospital in a hospital background, but it's also, if it demonstrates that you've got good team working skills, or you really going above and beyond in terms of organizational skills or what have you, you can record that in your additional achievements. So the other thing it's good for is specific academic achievements such as courses, taster weeks. If you do any exams, if you do any presentations, publications, make sure you put all of that in there. Also for any procedures that you want to document, particularly if you've got surgery in mind, then that all goes in your additional achievements. Sorry, I was just checking the chat. So personal learning log. This provides a lot of problems throughout the year, but it's very straightforward. So the personal learning log is where you record all the learning, essentially, that you're doing throughout the year to make sure that you are hitting what's required as a foundation doctor. But it also sort of keeps the foundation school in check, that if everyone is struggling, then there's clearly something wrong with teaching, as foundation is a teaching post. Okay. You have core and you have non-core hours. Core hours are basically the only things you can upload to the core hours of the personal learning log are the mandatory teaching sessions that your hospital will put on for the F1s. So that might be the hour teaching once a week on a Wednesday, or if you have a whole morning on a Thursday, however many hours that accounts for, those are the hours that would go into your core teaching. You can't really, unless your hospital states it, put anything else in the core hours, and that's to make sure that you're attending the teaching that they're putting on for you. Your non-core then is basically anything else that you do. Okay, so just to run through, discuss with the foundation school and peers, importantly, to find out what they're putting in and what counts. Sometimes you'll find that your peers are actually logging every MDT into the non-core, and so they've got their 30 hours with no problem, and that's perfectly acceptable. But sometimes if you're low and everyone else is high, you might be wondering how they've got there, so have a chat with them. Okay. Attending formal teaching goes in your core hours, but sometimes additional examples include things like if you have to do simulation training at your hospital and your hospital say that it can count in your core, If you have to do prescribing training and your hospital say that it can be counted as your core, or if you have to do e-modules that the foundation has specified, that potentially could also be a core. There's other examples, but it's always worth asking the hospital, your postgraduate centre, what can I use in my core? Is it just the teaching sessions, or can I include my sim sessions, my additional hours in the modules you prescribe, blah, blah, blah. Non-core is basically everything else, and to be honest, anything else. So if you have departmental teaching whilst you're on a ward, add that into your non-core. Any audit or QI work that you do outside of the hospital, add that into your non-core. MDTs can go into non-core, balance groups, grand rounds, e-learning modules, all of that can go into your non-core. The last bit about revision time, I would be very, very conscious or careful about doing that. Sometimes they will allow a certain amount of library/revision time, but other trusts are very specific about it. So don't go logging 8 hours of revision unless you've checked it with the hospital first. Okay. A couple more questions. Can we use extracurricular things from med school for this? I'm assuming you use you're talking about additional achievements. Really, no, not unless you're still continuing them. So I wouldn't go adding you were president of badminton in 4th year to your additional achievements. It's specific to that year, because obviously each year you're doing a new portfolio. If, however, you still work with the university's homeless charity, and as an F1 in your F1 year you have been elected as president, as you can oversee certain things, then yes, of course you can add that. Okay. Does the e-learning modules during induction week count as core? So you should be asking them that, and that is definitely something that you can ask them. If they say no, it doesn't count as core, add it to your non-core, because if you're taking any time out of your day to do e-learning, you should be recording that somewhere on your portfolio and making sure that you're getting some hours back for it, basically. Hope that helps. So, top tip, keep on top of your PLL. This is something I didn't really do this year and really suffered for. So it's really, really easy to log 60 hours in 52 weeks. It's really difficult to log 60 hours in 7 days. So every couple of weeks, check in with your PLL and make sure you record whatever you attend. The other thing to do to make sure is vary what you're logging. It may be acceptable, but it will look a little bit suspicious if you've just logged 30 hours of MDT and nothing else. People, obviously, during the ARCP, tutors will look at your portfolio in amongst everyone else's, and they will look at it in detail. And if they spot that all you've done is attend MDTs and nothing else, they may be a bit skeptical of that. Okay, so HLOs. These are the higher learning outcomes. So what we'll do is discuss thoroughly to ensure that you're mapping things to the HLOs correctly, and we'll again just recap the curriculum summary narratives and make sure that they're accurate. So the HLO overview, there are 3. The first one's about the clinician, second one's about the healthcare worker, and the third one's about the professional. So anything that you're doing that you think this demonstrates good clinical skills ultimately should end up mapped into your HLO1. Anything that you're doing that you think, oh, well, this makes me look like I'm thinking outside the box within a good team environment, and I'm thinking about the system, that should go into HLO2. And anything that you're thinking, this is clearly showing that as a professional, I'm gaining more experience, I am acting more professionally within the department, that's going into HLO3. Okay. Ultimately, mapping things to the HLOs, as with your whole portfolio, is just to demonstrate that you're delivering safe, compassionate care, and that you can do it under indirect supervision across generalized specialties going into F2. Okay. So, top tip. HLOs are intrinsically vague. So if we go back, what on earth does it mean to be a valuable member of the healthcare workforce or a professional responsible for their own practice and portfolio development? Okay, so they're vague, so you can be vague. Okay, think about everything that you're uploading. attribute it to one of the subdivisions without fail, and be prepared to discuss how and why you've done that. But as long as you can defend your answer, then that's perfectly reasonable. Okay, so mapping evidence. With everything you upload to your ePortfolio, you will then need to map to one of these HLOs. You don't have to map all of your evidence, but sometimes the clinicians, or during the ARCP, they will only look at what is mapped. And so if it's something you're particularly proud of, I would make sure you're mapping it. As I say, you don't need to map everything, but every HLO and every subdivision of the HLO needs to have something mapped to it. And generally, it needs to have 2 or 3 things mapped to it as a minimum. So make sure that you're checking your curriculum. So if we go back to this page, make sure that you're going onto your curriculum, you're having a look in your HLO, and you're having a look at each of these subdivisions to make sure something is mapped to them frequently, so that you know if you haven't got something mapped to it, you need to make something that does map to it. So submissions can be mapped based on what you've created, or rather differently, you can create something to an area that you need something mapped to. So if you know HLO1 subsection 3, you haven't got anything mapped to it, you can do a DOP, or you could do a learn or a leader, an SLE, and then knowing that you're going to map that to that specific HLO. So that tends to be more required in the second placement and the third placement, when you start to really need to fill in some gaps in your portfolio. Okay, so HLO1 is a accountable, capable, and compassionate clinician. It's then split into clinical assessment, prioritization, holistic planning, communication, and continuity of care. And you can map anything into these, but this is what I'd advise. So SLEs generally fit really well into this group. So mini KEXs, DOPs, CVDs, you can easily map into HLO1. But also think about things that you're doing every single day. So ward rounds, asked to see patients, post takes, venipunctures, cannulation, all of that sort of stuff is demonstrating that you're a capable clinician. You can also map tabs, reflections, and additional achievements here that are showing you're developing your clinical skills. Importantly to note as well, you can map things to several different areas. So you could map your tab to your HLO1, your HLO2, and your HLO3 if you wanted to, just to make sure it hits all the areas that you wanted to. HLO2 is let me just check in for any questions. No more questions, good, but please do keep asking if you have anything. So HLO2 is a valuable member of the workforce. Top tip, look at what the HLO wants. So you need to show that you're valuable, and you need to show that you're working within the team. So tabs and PSGs demonstrate this really well. You can also map your PDPs to these. So if your personal development plan states within it, in the third block, I want to demonstrate that I am a capable member of the healthcare workforce and that my skills reflect this, then you might get a piece of feedback that you can reflect on in your PDP at the end of the placement and say, yeah, I've mapped it to this because it shows that I'm capable of acting as an F1 and an F2 next year. The other thing is QI projects and audits show quality improvement within a department, which ultimately further the healthcare workforce. That department would get better, that would increase productivity, all the rest of it, which would then show value and make sure that you are a proficient member of the workforce. The other things to note is you can map in here things like DCTs, which are also an SLE, and any additional achievements. So teaching, any courses that you attend which show extracurricular engagement or bettering of yourself. And then PSA, courses, as I say, seminars, exams, all that sort of stuff. And HLO2 is split into these categories here. So HLO3, professional responsible for their own practice and portfolio development. This is quite a difficult HLO. There's only 3 sections to it, so you can fill it out quite quickly and easily once you sort of realise what you can be filling in. So it's split into ethics and law, continuing professional development, and understanding medicine. So think about what you're putting in terms of, add things here that can be uploaded to this section. So write reflections that, say that you're thinking about the capacity of patients or the legal framework behind the events that are occurring. So if you certify a death, or if you are involved in the sectioning of a patient, which obviously you can't do as an F1, but you can reflect on how you would do it, or how that leads to, how that is done within the healthcare setting. Anything outside of the day job or towards career planning can contribute to continuing professional development. Often courses will say this is 10 CPD points or whatever. Courses and things like that will show that you're developing professionally. Understanding medicine, here I'd be creative. So I would do reflections that show I'm thinking about the holistic care of patients. I would do a leader activity which shows I'm understanding my role within medicine and that I am furthering my development to make sure that I am responsible for my own practice. Let's just check in. Any questions? 1. Can you please go back to HLO1 top tip? I can indeed. So top tip for HLO1. Didn't have a top tip, I don't think. Essentially, SLEs, my top tip for HLO1 is SLEs fit really well in this HLO. And if you do an SLE, it can almost immediately be uploaded into HLO1. So yeah, this HLO1 will pad out really, really quickly is what you'll find. Okay, that probably didn't answer your question, but if you retype it, or it didn't answer it. HEE, e-learning for health. This is a get out of jail free card, and it is well worth knowing about. So the e-learning for health enables you to complete modules on the Healthcare Education for England website that are directly related to specific HLOs. So it's really good if you're struggling with any particular HLOs, particularly, sort of HLO 3 subsection ethics and law or whatever. You can do an e-learning module which you can then directly link to there and is accredited by HE. The problem with these is they can be time consuming. So actually you may find that it's easier to do a reflection as opposed to an e-learning module. However, you might find specific modules actually curb your interest and might be beneficial for your future progression. So things like audits, lit reviews, they've got some pharmacy and microbiology review modules and things like that. So where do you find this? So you go into portfolio, you go into your curriculum again. Obviously you've got all the things here and you've got where you would add your clinical summary narratives. But if you turn all of these 3 off, so your mapped evidence, the guidance and the descriptors off, just turn on HE e-learning for health, and suddenly all of these things will pop up. You click the hyperlink and it takes you to a module. You need to register with HE or the equivalent in Scotland, but if you click on these, then it will take you to that module, you complete it, and then you can directly map it to HLO 1.1 or HLO 1.9 or whatever. Okay, so we've reached the end. We've reached the Q&A section, but you've been asking questions throughout, which is great. I'm just going to monitor the chat now instead. I presume we can't use CPD points gained in med school. No, again, I would, if it's something that you want, let's say you did a course on wilderness medicine, and you want that recognised within your portfolio, you could add it to your additional achievements, but then I would specify when you're uploading it in the box that says additional contributions or whatever, this is a course that I did in my 5th year of university, however, I would like it recognised in my future career progression or whatever. But no, it can't really contribute to your ARCP and F1. Any other questions? question? No, just thanks. Okay. Fine. Thanks to the events. Makes ARCP less scary. Yeah, honestly, ARCP is not scary at all, providing that you've just ticked along with things throughout the year. Don't save it all to the end. You'll be really in trouble. That's when it gets difficult. Actually, if you just add things occasionally throughout the year, then there's really not a lot to it. I've managed to go through all of the content for ePortfolio within an hour's session, because there really isn't that much to it. So yeah, don't worry about it. Okay, well, if there's nothing else, then you guys feel free to log off. You can email me any questions that you might have at any later date. I'm happy to help wherever I can. Yeah, any other questions, I'll hang around for a little bit and keep an eye on the chat. But if not, enjoy the rest of your Thursday. Sorry, what was the e-learning for health in? So if you go onto the e-learning for health, is basically where you can find modules specifically to do that you can map to specific areas within your portfolio. So if you're struggling on a particular HLO within your portfolio, then you can do a specific module that you can directly map to that area. And it's found under the curriculum within your portfolio. Okay. I'm going to head off now, guys, but